Welcome to Global Dispatches, a podcast about foreign policy and world affairs. I'm your host, Mark Leon Goldberg, editor of UN Dispatch. And in this show, we discuss topical global issues, have conversations with foreign affairs thought leaders and newsmakers, and give you the context you need to understand the world today. Go to globaldispatchespodcast.com to learn more. And now on with the show. Nigeria has a population of over 200 million people. It is the largest country in Africa. 1 in about every 6 people in Africa live in Nigeria. The country is now in the midst of a second wave of COVID infections, which is straining an already fragile health system. But even as countries in North America and Europe roll out national vaccination strategies, Nigerian officials have not been able to secure any doses of any COVID-19 vaccine for their frontline health workers, let alone their general population. My guest today, Dr. Faisal Shuaib, is the Executive Director and CEO of Nigeria's National Primary Healthcare Development Agency and a member of the country's COVID-19 task force. And in our conversation, he explains the impact of COVID-19 in Nigeria and the difficult task of securing doses of the vaccine. He also explains how Nigeria's successful campaign to eradicate polio is informing the country's response to COVID. This episode really underscores how inequitable access to vaccines has been across the world so far. You can definitely hear the desperation in his voice when we discuss the challenge of securing doses for the people of Nigeria. This episode is a valuable opportunity to hear directly from a health official in a large developing country about some of the challenges they are facing, confronting COVID-19 over a year into the pandemic. And today's episode is part of a series of episodes featuring African perspectives on peace and security issues in Africa that is supported in part through a grant from the Carnegie Corporation of New York. To view other episodes in that series, please visit globaldispatchespodcast.com. And as always, please feel free to reach out to me if there's anything on your mind, if there are suggestions you have of people I should interview or topics I should cover, send them my way. I love to hear from you. All right, now here is my conversation with Dr. Faisal Shuaib.
So I am a member of the Presidential Task Force on COVID-19 for Nigeria, specifically because of my experience in combating Ebola in 2014, and because my agency, the National Primary Healthcare Development Agency, was the lead agency towards the eradication of the wild polio virus in Nigeria. So that comes with experience really in emergency situations. And with the National Primary Healthcare Development Agency that has oversight, coordination roles around primary healthcare in Nigeria, that sort of provides us with the latitude to be able to reach the subnational level to communities, engaging them in information, education, and communication around COVID-19, and also making sure that primary healthcare workers have all of the tools that they need to continue to provide routine services, even in the face of COVID-19. But beyond and above that, making sure that they have the capacity to manage and refer appropriately cases of COVID-19 that come to their health facilities.
What is the situation right now of COVID-19 and the impact of COVID-19 in Nigeria?
So in the last couple of weeks, we've started seeing an increase in the numbers of cases. So the reality is that in Nigeria, the second wave is here. So, for example, we are witnessing record numbers of COVID-19 cases. Yesterday, we had up to over 1,600 cases of COVID-19. That's a record for us. And we're also beginning to see an increase in the numbers of fatalities. So this is a cause of concern to the presidential task force because we're now also beginning to see that some of the isolation centers are becoming are becoming full. The beds are becoming fewer. A few days ago, we started seeing situations where some of the health facilities providing this care to COVID-19 patients were struggling with making sure that they have adequate oxygen supply. Some of the scenarios that we've seen in other countries. So that is sort of where we are with increasing numbers of cases.
In other African countries, at least early on, some of the modeling on the expected impact of COVID-19 was wrong. It didn't take into account the relative youth of population compared to that of the populations of, say, Europe and the United States, which are relatively much older populations. Are you seeing sort of comparatively that COVID is less deadly in Nigeria as opposed to in the United States or Europe?
Right. I mean, I think this modeling was all across Africa. There were huge expectations of a doomsday scenario where we will see hospital beds being overflown by patients and really, really worse case scenarios, much worse than we would expect from what we're actually seeing in United States and other countries. And yes, at the time that this modeling was done, I don't think there was a lot of consideration for the relative youth of the African population. Same case in Nigeria. But what recent studies are also showing is that it is possible that apart from the demography, apart from the more youthful populations we have in Africa, there is a likelihood that there is cross reactivity, cross protection of, maybe as a result of exposure to similar, strains of the coronavirus, that is currently causing this pandemic, that many Sub-Saharan residents, some Sub-Saharan African residents probably came in contact with viruses that have, similar, presentations in terms of antigens. And because they've been exposed in the past to these types of antigens, they developed antibodies that were able to provide some protection against the virus. So, what these studies, indicate, of course, is that it's not just the demographics, but potentially the cross reactivity. And then there are, also some studies that indicate that perhaps because of the BCG inoculation that most Africans get at birth, that has some protective cover. It provides some protection against COVID-19, as it were. So multiple reasons are being, adduced for the fewer cases. But of course, we have seen that irrespective of the smaller numbers that we have, people are still dying. And even if it is one person that dies in a family, if it's somebody that is close to you, that is one person too many, right? Even if we're not seeing as many deaths, people are really concerned that with more cases occurring, then there are likely to be more deaths.
What's the current state of play of the vaccines in Nigeria? Have vaccines arrived in Nigeria yet? And what are you expecting?
No, we don't have any vaccines yet. Like many low-income and middle-income countries, we're relying very heavily on the COVAX facility. So the COVAX facility, as you may be aware, is a groundbreaking collaboration that was established by the World Health Organization, Gavi, CEPI, UNICEF, and a number of countries to ensure equitable and fair supply of COVID-19 vaccines to low and middle income countries in a way that, irrespective of the ability of the country to pay, they'll be able to have access to vaccines. What we have seen, of course, is that most of the developed countries have really mopped up and have paid in advance for a lot of the vaccines. This has made it difficult for the COVAX facility to make vaccines available. So a few weeks ago, we had communication that we were likely to get up to 100,000 doses of the Pfizer-BioNTech vaccine in Nigeria. But what we're now hearing is perhaps that we're not going to get these vaccines in January, but most likely in February. And then even when we get the balance of the vaccines in the first quarter of 2021, it may not be the kinds of volumes that we expect. So, for example, the COVAX facility is supposed to cover 20% of Nigeria's population for free, right? That 20% of the population comes to right around 42 million people. As of this time, we've not received a single dose, and we do not know for sure if these doses will come in March, right?
So it's just worth emphasizing that Nigeria is the largest population in Africa. I think like 1 in every 6 people in Africa is in Nigeria. It has a population of over 200 million. And you might get 100,000 doses of a vaccine in March.
A drop in the ocean, right?
Oh,
that
man.
Is precisely where we're at. And this is a cause for concern. However, what we're doing is to engage with the African Union. The African Union has been able to access up to 270 million of vaccines through different engagements. Nigeria is plugged into that conversation. We've made an initial show of interest for up to 10 million doses of different vaccines within that portfolio. So we are hoping that even before the COVAX facility vaccines come, we'll be able to access some vaccines that will be able to go towards prioritizing our health workers, the elderly people, and people that have comorbidities. We're still engaged in conversations with other manufacturers. So, for example, the Chinese have vaccines that they've produced. We are in conversations also with the Russians. They have the Sputnik V, but the guiding principle for how we access these vaccines has to be that there has to be WHO certification that these vaccines are safe and effective, and then we will now subject that to certification by Nigeria's regulatory agency known as NAFDAC before we will deploy these vaccines for use in Nigeria.
So what's your impressions of COVAX so far then? I mean, on the one hand, it seems like, you are at some point going to get a lot of doses through COVAX, but it seems to not be happening at a speed or a pace that's sufficient.
Yes, you're absolutely right. So the COVAX facility, I know, is trying as hard as they are able to get these vaccines across to the 92 economies or so that have, that are participating. But the truth of the matter too is that the developed countries really have been able to outmuscle the COVAX facility, and they have, for example, access to more than 2 to 3 times the amount of vaccines that they need for their populations. My understanding is a country like Canada, has acquired up to 4 times what it requires for its population. So while COVAX facility is trying hard to get vaccines, the vaccines are delayed, and that is causing concern among Africans that the mantra of equity and fairness in access to COVID-19 is a dream that's not being realized as early as we would have loved to. So many developed countries have already vaccinated over 5 million of their populations, and African countries are still, waiting at the end of the queue. And this was exactly why COVAX was set up, not to replicate the types of, inequities that we saw with the development and the rollout of the H1N1 vaccines in the late 2000s, right, where African countries had to wait at the end of the line before they could access vaccines. So, in actual fact, we do believe that this needs to change if we're going to be able to control the COVID-19 pandemic. Then all countries need to have access, equitable access to the vaccines, because there's no way we're going to eradicate this COVID-19 virus without everybody having access to the vaccines. There's nothing like a partial eradication. So even if we have one country that has fully vaccinated its population, it would not be safe from other countries reinfecting it, just because the virus doesn't know any borders, right? So the best way is to make sure that not only in different communities do we have coverage, but also that we have different countries covering all of their populations. And that will only happen when there's equitable sharing of the COVID-19 vaccines.
So when those vaccines arrive, to what extent will your experience, Nigeria's experience, eliminating polio and mitigating and basically sort of avoiding the tragedy of Ebola that befell your neighboring countries, how much will that inform the vaccine rollout? I've seen it said, and I've seen it written before, that Nigeria's experience in combating polio and the surveillance systems that were created to combat and eventually eliminate polio were summoned to a great degree in containing the Ebola outbreak in 2011 and enabling Nigeria to avoid the fate of some of its neighbors, even though it's a much larger population. Are those surveillance systems and are those systems going to help inform the rollout of the coming COVID vaccine?
Yes, absolutely. You may be aware that we just got certified as wild polio virus free in 2020, just last year. So we still have the manpower, we still have all of the experiences from eradicating polio and controlling Ebola in 2014 within record time. These are the same experiences that will help us in rolling out the vaccines. So even beyond the resources that we have from polio eradication, almost every year we conduct between 4 to 6 immunization campaigns. So there are polio campaigns, there are measles campaigns, there are yellow fever campaigns, and sometimes meningitis campaigns. So the health workers really have gotten used to what it takes to conduct effective vaccination programs. So here we are. On the one hand, we have the template from the polio eradication program. But on the other hand, we also have this constant redefining, reimagining of different modalities to deploy different vaccines to very rural areas. Now, this is something that I believe that a country like Nigeria has experience in and can really teach other countries that are not used to conducting campaigns like the United States. So we're already seeing how with the rollout of the COVID-19 vaccines, the projections, the targets are not being met, both in the United States and the United Kingdom. And there are operational issues with getting the vaccines out as fast as possible. That could be partly because those countries are not used to campaign modes, right? They are used to delivering routine immunization, vaccines in a routine manner. People go to the health facility, they get their shots. But for countries such as Nigeria, we have to go to the health facilities, and from the health facilities to the communities. So we are in that mode where we are used to conducting campaigns. And that is something that will come in very useful that experience, that skill becoming very useful when it comes to deploying COVID-19.
Because basically like a campaign is just like a massive nationwide push to vaccinate as many people in as short a period of time as possible. It takes like months and months of planning ahead of time. And then you have a few days to just go out there and get as many vaccines in as many children's arms and as many communities. And it's just like a logistical feat, but it's one that you have experience with.
Absolutely. So, and this is why we acknowledge the unique nature of the population that are going to be vaccinated, using COVID-19 vaccine. And we know that there are different logistical challenges, but because we're so used to these campaigns, we feel more confident stepping one foot forward because it is something that we're used to. It is not completely novel. And we know that the health workers understand what will be required. So that makes us, feel that all of the plans that we've rolled, that all of the plans that we've put together, some of the simulation exercises that we're conducting are really in the right direction if we're going to be successful.
You just need those vaccines.
Like yesterday.
Dr. Faisal, thank you so much for your time. This was very helpful. And I just hope these vaccines, COVAX, kicks into action.
Right. Yeah. Thank you very much, Mark, for having me.
All right. Thank you all for listening. Thank you to Dr. Faisal Shuaib. And as I said at the outset, please do feel free to get in touch with me. If there's anything on your mind, you can hit me up on Twitter at Mark L. Goldberg or use the contact button on globaldispatchespodcast.com. And just one disclaimer that accompanies episodes that are produced in partnership with the Carnegie Corporation of New York, that the opinions and views expressed in this episode belong solely to those who expressed them. All right, we'll see you next time. Bye.